Alright, welcome back to the channel. Dr. Greg Pat here, physical therapist from PT Made Simple. Today we're going to talk about femoral acetabular impingement. You may also just hear it known as FAI. So pretty much what that means is impingement of the hip. That's what we're going to be talking about today. So there's really two main types of femoral acetabular impingement. You may have heard the term a CAM impingement, or you may hear the term Pincer. So both of these are considered femoral acetabular impingement. So you could have one of these, or you could have both of these. Both considered that FAI, what we call it. So first, if you look at the hip, not the best drawing here, but you have your femur, your thigh bone comes up, and then you have, this is called the head of your femur. And that goes into the hip socket. So it's a nice deep socket. The head of the femur sits inside that socket, allows us to kind of flex the hip, move it all different directions. The labrum would be down on the inside, adds a little bit of suction, helps kind of control the stability of the hip. Nice big deep socket. When we compare that to like the shoulder in other videos, where the shoulder is a ball and socket joint, but it's more like a golf ball on a golf tee. Big ball, little tee in the shoulder. Shoulder dislocations are the most common in the body. Hip, it's kind of the opposite. You have a nice big deep socket, and the head of the femur isn't as big, so it kind of sits into that socket nicely. So you don't really hear about hip dislocations as frequently. They still happen. Usually they're extremely painful, but not as common as dislocating the shoulder. So when you talk about the FAI, the first one we'll kind of talk about is a CAM impingement. So a CAM impingement, so as the hip kind of flexes and kind of moves up, a CAM impingement happens when there's almost like an overgrowth of bone on top of that. Sometimes it's just the way we were born, sometimes it's kind of from wear and tear over the years. But a CAM impingement is when you have a bump kind of on top of the head of that femur. So as you try to rotate up, instead of clearing underneath this lip and having no issue, nothing pinching, now that bump is pinching into there, and you get that pain when you go to flex the hip or any kind of rotation. You kind of get that deep kind of pinching pain in the hip. That will be called a CAM impingement. The next type you can have is you can have a pincer impingement. So CAM impingement happens on the femur. The pincer happens on the socket of the hip. So they call that socket, they call it the acetabulum. So a pincer happens kind of at the brim of the acetabulum. Instead of saying nice and smooth, now there's like a big bump down there. So as that femur rotates in that socket, it can cause pinching onto there. So pincer would be there. So you could have both at the same time. You could have just a pincer, you could have just a CAM. And again, a lot of times what happens is it can lead to some arthritis in the joint. It can lead to labral tears in the joint just because there's so much friction in there starting to kind of rub and cause tearing of that labrum, which we see quite a bit. A lot of times people have labral tears. It's because they have either a CAM or a pincer or both type of impingement there. So very common with people with hip pain, especially athletes when they're getting hip pain, especially college age, high school age, and they're getting that pain. Sometimes it can be one of these impingements. So that's FAI, or femoral acetabular impingement. So I hope that helps. If you guys have any other questions, just leave a comment. Or if there's anything else you'd like me to talk about, I'd be happy to. So just leave it down below.